You're on.
Hi everyone, my name is Erick COF. The topic I'm opening up for discussion today is illegal drugs. I'm making the claim that the illegal drugs in the United States have medicinal qualities. Some definitions I want to clear up before we continue. Illegal drugs will be defined as any substance mentioned in Section 812 of the Controlled Substance Act of 1970, and medicinal is being defined as the ability to alleviate symptoms for and/or eradicate illness, whether biological or psychological. My reasons for supporting that illegal drugs in the United States have medicinal qualities are that the classification of drugs is inaccurate, and there is research to suggest on cannabis, cocaine, heroin, and psychedelics that they possess medicinal qualities. So my first supporting claim is that the current classification of drugs is inaccurate. According to the Controlled Substance Act of 1970, Schedule I drugs have a high potential for abuse and no accepted medical use and treatment. However, an article by David Nutt in Nature Reviews Neuroscience states that this scheduling was made before modern scientific methods allowed a proper understanding of their pharmacology and toxicology. This means that at the time we were unable to fully test the effects on human health. A research study titled Drug Harms in the UK, a multi-criteria decision analysis, concluded that Schedule I drugs such as cannabis, cocaine, LSD, and psilocybin mushrooms are less harmful to oneself and others than legal drugs such as alcohol and tobacco. This goes into my next point about research being done on cannabis that suggests it has medical properties. A study by David Nutt the study we referred to earlier by David Nutt, also made the claim that people self-medicate using cannabis to improve their sleep, stimulate appetite, and reduce their anxiety. Other studies published in the British Medical Journal and Neurology concluded that patients with AIDS and multiple sclerosis, after using cannabis, experienced reduction in pain. The results were that the patients, after using cannabis, had pain reduction of up to 30%, as compared to a placebo, which only reduced their pain by 15%. These results are comparable to current prescribed oral medication. My third supporting claim is going to be about cocaine. In a conversation with Joe Rogan, Dr. Carl Hart, an expert on the effects of drugs, said that cocaine when it was legal, was used in the medical practice as an anesthetic and to restrict blood flow to make surgeries easier to operate. Cocaine is also similar to lidocaine and novocaine, both of which are currently legal. My fourth supporting claim is going to be about heroin. In the same conversation with Joe Rogan, Dr. Carl Hart talks about heroin being used as a painkiller. Heroin is derived from opium, and of which so are hydromorphone, morphine, and oxycodone, all of which are currently legal as painkillers, prescribed as painkillers. My fifth and final claim to believe that illegal drugs in the United States have medicinal qualities is the research done on psychedelic drugs. The first psychedelic drug I'm going to be talking about is 3,4-methylene-dioxymethamphetamine, also known as MDMA or ecstasy. The world's first fully approved controlled study to determine the effects of MDMA on a patient population concluded that MDMA is effective in reducing PTSD symptomology. The study included using low doses of MDMA in a small sample of women with chronic post-traumatic stress disorder. After multiple sessions of ingesting the drug and participating in therapy, their anxieties and negative effects of the post-traumatic stress disorder were significantly decreased. And according to the article, A Method of Conducting Therapeutic Sessions with MDMA, published in the Journal of Psychoactive Drugs, MDMA reduces the neurophysiological fear response to a threat on one's emotional integrity. This allows users to interact and observe with their environment without the primary somatic symptoms of fear and anxiety, which in turn also promotes a sense of love and forgiveness, which helps adults with autism and Asperger's normally integrate with society. Other psychedelics that has had research to suggest that they have medical properties are lysergic acid diethylamide, also known as LSD and acid, and psilocybin or magic mushrooms. A study entitled Response of Cluster Headaches to Psilocybin and LSD, published in Neurology, concluded that 90% of the patients who took LSD or psilocybin reported cluster period termination and remission period extension. So they either no longer had headaches or they went a long time without having them. In another study published in the Washingtonian concludes that 80% of participants who took psychedelic drugs such as LSD or magic mushrooms were able to obtain their goal of quitting smoking, suggesting that these psychedelics have beneficial effects in the fight against addiction. So with the evidence provided, I hope you guys can agree that illegal drugs in the United States have medicinal properties.
All right, well, you identify the proposition. I'm not sure about the controversy on this, especially since you suggest that the rating was done prior to our ability to make research on these types of drugs in the pharmacological applications meaningful. So it sounds to me like it might be an informative presentation and not necessarily an argumentative one, except for a couple of them where there are arguments about some of the things that are suggested, like marijuana, for instance, and whether or not it has those particular benefits. The studies, I think, are interesting. I appreciated the citations, and I thought you did a good job trying to find credible sources for all that information, not relying on generic popular culture publications, but rather using medical publications for the argument that you're making. I thought that was pretty effective. The one thing that I think is most problematic about the speech is at the beginning you set up a preview that consists of 2 points, and then the body of the speech consists of 5 points plus 2 or 3 points underneath each of those points. So it was a little bit confusing. I thought it was not consistent with the way you had set the speech up at the beginning. But the arguments that you're presenting about the effectiveness of the drugs on a variety of maladies, I thought those were generally good. There were a couple where you had a single study and you're willing to rest the inference that you're making on that single study. I thought that was a little bit problematic, but most of the ones that you cited had multiple reasons for believing that there was a valid use or application there. All right, thank you. Joshua.